Yanel.
Hi, how are you?
Hi, how are you?
I'm and I'm very grateful to be able to have an interview with you.
Oh, well, thank you so much. Um, so before we get started, I just want to say, surge unit, we do have a focus for some patients of population of our end-of-life care, but we do get, our general med-surge patient population as well. And we also do have 4 COVID patients currently, which is great because we've been able to open up the rest of our unit. So we're making progress, which is very exciting to report.
That's good.
Are you interested in full-time or part-time?
Well, currently I would be interested in full time. I am taking my bachelor's classes, so once September hits, I would probably go down to part time, depending on how much schoolwork I have. But for now, I would definitely do full time.
Okay. Are you doing online or in person?
Because of COVID, everything was online, but I did get an email saying that some classes will go back to in class. So as of now, I believe just one class requires me to go in class, but besides that, most of them are going to be online. I'm taking only 3
Okay,
classes.
awesome. And are you interested in days or nights?
I mean, it would be amazing if I get days, but as of now, I can do both.
Okay. And obviously you have school starting in September for your BSN. Do you have any other schedule restrictions, like planned vacations, weddings, anything like that?
As of now, no. There's nothing that I have planned for that.
Okay. So why don't you tell me a little bit about yourself and how you got into nursing?
Well, I'm actually 30 years old. I actually got interested in nursing in 2015 when I gave birth to my son. He ended up being a preemie, so he came 5 weeks early, and the experience I had in the hospital with the nurses, they were very caring, very it was the first time for me to have a kid, so it was kind of scary. I was scared. I was a little like uneasy, and I had a wonderful nurse that really took care of me. She really kind of like, I remember crying, because my baby was coming early. It was New Year's Eve. He's a New Year's Eve baby, New Year's Day baby. So it was kind of like unexpected. It was just so, everything was going on wrong at the moment for me. And she just held my hand, she held my hand as I was, tearing up. And, he had to be in the NICU for 2 weeks as well, and he was super tiny. So just experiencing being there with nurses, they helped me, they guide me with everything they could, and they were very caring. And I think that I honestly hold that dearly to my heart. And that's where I was like, you know what, I think nursing is a career for me. And well, here we
Awesome.
are. I'm a newly registered nurse, and I'm just seeking to expand my knowledge and get the experience to pretty much
Okay, great.
eventually move up to labor and delivery.
Is that your goal?
That's within my 5 year goal. Definitely, yes.
Okay. And what are some strengths do you think you can bring to the team?
Some strengths that I could bring to your team would be I am pretty much a very hard worker. I am a fast learner, and I do believe that I'm very perseverant. So I'm a team player. I love to work as a team because I do believe that when you work as a team, you can definitely give better patient-centered care. And I just think that I am a person that would really I'm reliable. I'm 100% committed to what I do, and I'm always trying my best, and aspiring to grow every day.
Great. Now, what strengths come? I would call it opportunity for growth. We don't like to call them weaknesses. So, what's something you think you could work on?
Well, one thing that I could definitely work is on my experience. Lack of experience is, I would consider, one of my weaknesses right now. But another one would be that I'm very independent, so it's very difficult for me to ask for help most of the time. But I am working on it. I'm working on kind of like, vocalizing and letting if I need help, I would require the help, and be getting comfortable with that. That would probably be one of my weaknesses.
Okay. Now, can you tell me a time when you've had to deal with, whether it was in clinical or maybe another job, where you dealt with a patient that maybe was not happy or a customer that wasn't happy, and how did you deal with that situation?
There was this one time that there was this one patient, and he was just having I believe he was just having a bad day, and I was a nursing student. I came in, and he just didn't want me in there. He just wanted to be alone. So I listened to what he was saying. Like, he was like, I want to be alone. So I went back to my clinical instructor, and I was like, look, he doesn't want me in there. But she was like, okay, just try to see if he needs anything. Offer yourself. And that's what I did. I went back. I was like, I understand. I pretty much kind of like let him know that I was listening to his request, that I knew he didn't want me there. And I just told him that if he needed anything, that I was just a call away, that I would be taking care of him. And if he just needed me to just sit there with him and just be silent, that I could do that as well. And eventually he kind of like, I guess he felt bad because of how he handled himself, a little bit rude to me. And he just eventually kind of like warmed a little bit more, and he asked me for water, no ice. So I went and got him his water, no ice, and I just made sure that he didn't need anything else, and I gave him his space, but I made sure that he knew I was around for whatever else he needed.
Awesome. Now, this is a random question. If you could be an animal, what animal would you be and why?
If I could be an animal, and I would be an eagle.
Okay.
And
Why?
the reason I would choose an eagle, I think it's because, one, of course, they can fly. I think it's amazing to be able to see the world from all the way up there, and I feel like eagles they're leaders. They're independent, and they are just free. I would say that.
Good. Now, I have a clinical question for you. So, yeah, obviously we have chronic pain, which is never going away. We have all different types of patients and stuff like that. So, say you're caring for a patient, and patient's complaining of pain, and they're on a pain regimen, and you give them their pain meds, and about 15 minutes later you see their call light on, and you go to answer the call bell, and they are laughing, they're on the phone. So you go in, how do you handle that situation? Talk me through the steps of what you would do for that.
I'm sorry. Would you be able to kind of like repeat that for me?
Sure. So you have a patient that has a history of chronic pain. They're on pain meds. You go in, you give the patient the pain meds, and then about 15, 20 minutes later, you see their call bell on. You go in to answer it, and they're laughing on the phone, and then they say, I'm still in pain. Talk me through your process of what you would do.
Well, if the patient, after I gave him his medication and I went back 15 minutes later to see if the medication's working, and I see that the pain is still um, he's still in pain, even though the patient's laughing, I would ask the patient to rate his pain from 0 being no pain, 10 being the greatest pain. And then based on that, I feel like pain is something that it's different for everybody. So I would definitely consider that even though he's laughing, he or she are laughing, that I would acknowledge that they're still in pain. And depending on how their pain is, and depending on the order that I have from the doctor, I would see if I can administer more pain medication for them.
All right, great. And if there was anything else you think you could also do?
I would well, I would pretty much just make sure that the patient is okay, that verify that I'm doing everything, his name, date of birth, making sure that it's the right patient, the right time. I would definitely probably call the doctor as well, just to kind of like verify with him if I'm allowed to give him more pain medication.
So that's great, but before you gave more pain medication, are there any other interventions that maybe you could do prior to that?
Oh, other interventions? Well, I'd probably make sure that is there any other non pharmacological interventions that I could do to help ease the patient's pain.
Good. What questions do you have for me?
Well, one question would be like, how does the orientation process work?
So normally the orientation process, obviously due to COVID, things have switched up a little bit. So you do come in for maybe one or two things, but everything else is virtual. And then that's about a week for hospital orientation. Then once you're taken off hospital orientation, you will start to come to the unit. So for about a couple weeks, you will do like an 8 to 4 shift Monday through Friday. You'll shadow different disciplines. You'll go see wound care, physical therapy, respiratory. You'll shadow nurses, team leaders. You'll do all of that, and you'll kind of get a lay of the land, kind of get to know everybody, and then we will put you with a preceptor, and then you will start to orient with them. And orientation's about 12 to 15 weeks, but I don't like putting a number on that because it could even be less than that, or you might need a little bit more. And then if you were hired for days, obviously you would continue orientation on days, but if you were hired for nights, you would orient a period on day shift and then transition to night shift.
Okay. Okay, so...
We also have a program called Rising Stars, so that's like our nurse residency program. So you go through and attend different classes and kind of discuss different topics as newer nurses, and it's kind of coming together with the same newer nurses that you went through orientation with.
Okay, perfect.
And then throughout your orientation process, you meet with myself and the professional practice and development coordinator. We meet on a weekly basis, and we'll meet with your preceptor, and we'll kind of go through your packet and ask you questions, and then it also gives you a time to kind of talk through your patients and have any questions that you may have.
Okay. And my second question was like, when would I expect hearing back from you regarding the interview process and if I would potentially be a candidate for this job?
So it's moving pretty quickly. So if you were to get the position, you probably hear from Carly as early as today or by the end of this week. And then if you were to be hired, they're starting like the background checks and everything pretty quickly.
Okay. Okay, sounds great.
Do you have any other questions?
No, I think that's pretty much both the questions that I have.
Okay, awesome. Well, it was a pleasure speaking with you and meeting you, and I wish you all the best, and Carly will be your point person.
Thank you so much, and again, thank you for taking the time to giving me this interview, and hopefully I'll be able to meet you in person soon.
Awesome. Sounds good. Take care.
You too. Thank you. Bye-bye.
Bye-bye.
Hi, future nurses. So I just finished my live interview. It was actually, because of COVID, it was more of a kind of like Zoom meeting interview that I had. I was not able to see who I was interviewing with, so it was kind of like a little difficult. I was trying to smile, but then I realized I was just smiling to no one. But so far, I think it went well. I did kind of blinked once she mentioned the clinical question. I felt like I was too nervous, and I kind of let like the the anxiety get to me, and I blinked for a second. I did have to ask her to please repeat what she was asking, and eventually I believe I did give her what she was asking for, which is when the pain has chronic pain, which is chronic. The key word I believe was chronic. And you administer pain medication, and then after 15 minutes it's still not they say that they're still in pain, but they're laughing. So one thing that I learned in nursing school is like, we always have to acknowledge that everybody feels pain differently. And I answered that I had to rate the pain from 0 to 10, 0 being no pain, 10 being the greatest pain. But I did forget to, do it step by step, to make sure that before giving the medication, you have to see if there's any non-pharmacological interventions that can help the patient ease their pain. But I think once I gave her that, I replied about the non-pharmacological interventions. I think I gave her what she was looking for, because that's where the question pretty much stopped, the questions. And yeah, I just my two questions that I have for them was, the how would the training, the whole clinical, like, how would the training process be, and just to be aware, to know. And I also wanted to know how soon I would get a call back from them. So what I'm gonna be doing now is I'm just gonna email her, thanking her for the opportunity to allow me to have an interview with them, because this hospital is a magnet hospital, and they don't usually hire associates. They are opening the positions, and recently a friend let me know, so I immediately I feel that I went through Indeed.com looking for nursing positions, and I remember just submitting my application and getting a call from the Atlantic Care, one of the people, the recruiters, and within 1 hour. So I was super excited. I was finally able to get the interview, and I'm just hoping for the best. I am really excited, and I did envision myself working in the magnet hospital while I was in nursing school, and I'm just hoping that I am a potential candidate, that I will be getting a call back from them. So from there we will see, and I will just be updating you guys. Okay, so now I'm back. I just finished writing the thank you email for the manager of the floor, the unit I'm applying to, and this is what I wrote. I wrote the following. For the subject, I said, thank you for the opportunity to interview. And then I said, hi. I put the name of the manager who just interviewed me, and I said, I just want to thank you for allowing me the opportunity to interview with you today. It was a pleasure meeting you and hearing about your MedSearch unit and the progress of opening up your unit. Uh, she did mention that uh, recently they started opening up their unit and only have for COVID patients, so that's a huge progress for her. And I did want to, mention it and let her know that I was listening. And I wrote the following as well. I said, I do believe it would be a wonderful place to work alongside you and your team. I admire the mission and vision Atlantic Care offers to its community, and it would be very exciting to be part of a magnet hospital in your team. I am a hardworking and dependable individual with a strong work ethic and would welcome the opportunity to work with you all. Again, thank you so much for your time and consideration. I look forward to hearing from you soon. Best regards, Anel Ortiz, RN, and then I put my email and my phone number as well, just to, look professional, and in case she wants to reach out again, or the recruiting. I put the nursing manager who I just interviewed with, as well as the nurse recruiter, so they both can see my email. And I'm just gonna. They said that I could hear back from them as early as today, and as soon as the end of the week. So I'm just gonna wait patiently, and I will definitely be updating you guys. So I hope this video helps you of how with the nursing interview questions, the answer, well, mainly the questions, what they pretty much look for when they're interviewing you, and just kind of like the process right after of what it's always good to do a good thank you email or letter, and just kind of like follow up and everything. So I hope if you guys like this video, please give me a like. Don't forget to subscribe for future videos and updates to see if I got the job or not, and then we'll be seeing you soon. Take care.